Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with this edition of the Dr. Bob Rakowski Podcast. I have Dr. Michael Biamonte, and that's a very poetic name. And this is a man who is a maestro of Candida, a maestro of the gut, just an epic functional medicine practitioner. Michael, we're recording this again. We recorded once before. I was blown away with your wisdom. The audio didn't turn out good, so now we're going to get it super quality for people out there. But first, happy, beautiful day. How are you?
Very good, Bob. Thank you very much. And again, it's my pleasure to be with you. As I said the last time, you were always one of my favorite speakers when I attended IAACN symposiums, so it's an honor to be with you.
Well, let's go back. How far back? When do you think you first met me the first time in the IAACN?
Jesus.
90s?
Yeah, easily, because I think the first one was in '89, and that was the Florida Association. It wasn't officially IAACN yet. So yeah, it would have been in the early 90s.
Yeah, so think about that, right? We go back that far, and here's what's so interesting. Our message continues to evolve and only building on how right we were, how you don't want to be processing food, how dysbiosis is real, how Candida can be an absolute hidden scourge. But let's talk about your journey and where you started with this and ultimately where you are today.
Well, when I first got out of naturopathic school, I was fascinated with lab tests and interpretation of lab tests. And this is when personal computers were very first coming out. So I wanted a computer program that could take all the knowledge that I had on interpreting blood work and do it computerized for me. And that was back then like an unheard of idea. But I happened to be in a health food store one day, and I was telling the owner what I was trying to do, and they told me that I had to talk to this fellow who's named Bob Santoro. And she said, he already has this going on. And I said, well, tell me about him. Well, he works for Grumman Aerospace. He's an aerospace physiologist, but he's also a nutritionist and a naturopath. So I met with him, and 12 to 15 years later, we had, with the help of a lot of other people, constructed a computer model of the human body that was based on Fortran language. So you could just move tables around. And we had Ken Brockman's work, Jim Seema's work. We had just about everybody who was a who in interpretation of blood tests in the computer.
Yep. So let's make that clear to everybody. Way back then, these were the who's who. That was the brain trust you were looking to be part of.
Mm-hmm. This is true. And in using the computer system with patients, we noticed there were some people who had strange results. Most people were getting great results because the computer had artificial intelligence back then that could track their progress. Every time they came in, the computer would compare their tests and see what supplements the computer gave them and what the difference was. But some people were getting weird reactions to the vitamins. And when I interviewed them, I found that they also had weird reaction to medications. So the first thing I thought of is they had low stomach acid because that's a known reaction. But then I started to investigate more, and I found out they all had Candida, which I didn't really know much about. And at that time, I was so naive. I told them, go to your medical doctor, tell them you have Candida, and have them cure you, and then come back, and we'll put you back on the program. Well, I got phone calls. The doctor says there's no such thing as Candida. Everybody has Candida. So I didn't know what else to do, but the only thing I could think of was to send them to Bob Atkins, who was the only functional doctor really I knew. There was Bob Atkins and Ronald Hoffman. Those were the only two back then.
Atkins of the Atkins diet, basically extreme ketosis, which would ultimately starve the Candida. That was a very sensible way to go. Interesting.
He was the only functional doctor. There were only like two functional doctors at that time, probably, in Manhattan, which is where I was practicing. There was Ronald Hoffman and Dr. Atkins. So when the patients went there and they came back and they told me, well, this was much better. He knew what you were talking about. He knew about Candida. And they put me on nystatin, and I took it for 3 months. And in the beginning, the symptoms went away. And then after a while, all the symptoms started to come back. And they even raised the dose of nystatin higher and it just made it worse. So that's when I decided I had to figure out what this was all about. So I started researching Candida from the viewpoint of listening to what the patients were telling me and then hitting the textbooks to see how, in other words, I was reverse engineering what was happening. And that's when I made so many of these discoveries that are in my book, The Candida Chronicles. The first major discovery I made was that Candida was highly mutative, and it would genetically mutate or genetically switch when it was exposed to the same medication for 21 days or longer. That's when the mother cells would impart this data to the daughter cells, telling the Candida how to avoid being killed by whatever this medication was, and that's when it would genetically mutate. So that right then I learned that you had to rotate antifungals. In order to be effective, you can't take the same antifungal every day. You have to switch them around. So you take 2 or 3 or 4, and then every 4 or 5 days you switch to a different one. And if you do that over a prolonged period of time, you don't develop the mutation.
Well, now for people where that may seem a little bit odd, think about antibiotic resistance. Everybody's heard of that.
Mm-hmm.
We can talk about viruses, and what it's known is what a virus will do. If a virus kills its host, well, it's jeopardized its own future. So viruses tend to mutate to less aggressive. And that's some of the argument that many of us were making about this last wave of virus that people were concerned about.
Right.
It just becomes less and less. But now that's the interesting thing about Candida. It wants to survive. And when it mutates, it seems to become more problematic than a better host. So let's talk about that, or I should say a better guest, because they're not a host. Yeah.
Back in those days, I developed a lab in my practice. So we had a lab and we would do a culture. It was a very good culture that we got from France. I forgot the name of it, but it was very effective. It was very expensive. So expensive, most of the local labs wouldn't even use it. And what we found out was very interesting, is that all the patients who came to me who had their long stories about how they've been fighting Candida for years, when we cultured their stool to find out what species they had, none of them had Candida albicans. They all had Candida tropicalis or Candida glabrata in some cases, but they were advanced species. The only people who had Candida albicans were the people coming to me who had never heard of Candida.
Wow. So, wow. So that just lends credence to exactly what you said. But then let's talk about your level of commitment to go ahead and actually start analyzing stool. I mean, that's about as committed as a human's going to get. I can't think of too many dirtier jobs than that.
No. Well, luckily, I was friendly with Marty Lee. I don't know if you remember Marty. Marty Lee from then Great Smokies.
Yeah.
And I was telling Marty everything I was doing, and he said, listen, I'll do this for you. Get a group of patients together, have them send a stool sample in every week, and we'll do this for 3 months, and we'll see what we come up with. So I got 5 patients, and they submitted a stool sample every week for 5 weeks. For about 3 months. And we looked at all the data cumulatively, and the interesting thing we found was that the levels of the bacteriology cultures, so the levels of their commensal flora, were very stable. If they had an absence of lactobacillus or bifidus, it stayed that way. The Candida markers were all over the map. So we had a patient 1 week who have a 4+ Candida. Next week there was none. Next week there was a 2+ Candida. Next week there was 3. Then there was none again. Then it was 4+. So the Candida was very unstable on the cultures they were doing. But the bacteriology was very stable, and we found out that the people who would test at least positive 3 times for Candida during this period were all the ones who had an absence of friendly commensal flora. So we started to adapt this new interpretation policy, let's say, that if a person had a lack of gram-negative E. coli, the friendly strain, a lack of acidophilus, a lack of bifidus, we automatically took that as a positive diagnosis for Candida, because we knew that if they continued to submit samples, eventually the Candida would show in an overgrowth. But there was no guarantee it would show in that one shot. So when I looked at that and I started studying how Candida grows in your gut, it grows in a very inconsistent manner. It's not like bacteria, which is like moss growing up a building. Candida grows in a very spotty, splotchy manner in your intestines. So if you could walk through your gut with a flashlight, you'd see lots of friendly bacteria, and then you would come up to this colony of biofilm with Candida, with parasites, with bacteria, all these organisms being synergistic and symbiotic together. And then you'd walk, and then you see nothing again. And then after a while, you'd come up to another colony. So this made sense, because I saw what was happening is the stool samples that had adequate time to contact those colonies would pick up the organisms, and then you could replicate them, hopefully. But other stool samples that were moving at a different rate or weren't in contact long enough with those colonies weren't picking it up, which is why it didn't show on the test.
That is beyond fascinating. I'm going to take 1 second for a commercial break and then get back to that. There's an herb called reishi. It's in our coffee, the best organic coffee in the world. Reishi, go to PubMed.gov. You'll see that it can actually begin to dissolve the Candida biofilm. Good for yeast, parasite, bacteria, fungus, even 17 different types of cancer. Keep in mind, if you've got a serious case of Candida, you probably want to connect with an expert like Dr. Biamonte, and we're going to continue to talk and share some of his amazing secrets. So now that you're rotating Candida remedies, so let's go with this first. Can you kill Candida without starving it? You mentioned Bob Atkins, and that's always been part of my protocol, and it might be the part that people are most challenged by. Can you effectively kill it without starving it? And if you can, okay, I didn't think so.
Nope.
I didn't think so. So let me hear your dissertation on that, because you certainly would know if anybody knows.
Well, it's like a war. The purpose of war is to make your enemy more amenable. And in the war with Candida, you need to starve it, because when you starve it, it weakens, and then it's more likely to succumb to your treatment. But Candida grows a root system. Candida is literally a vegetable, which is why, on this as a side note, which is why we use enzymes very high in cellulase to partially digest it as part of the treatment, because it's a vegetable. So if you look at it under the microscope, it looks like this broccoli or cauliflower, growing wild in your intestines. But it does grow a root system, and this root system taps into your tiny blood vessels to draw glucose out to keep it alive, because it primarily feeds on sugar. So you can't kill Candida unless you partially starve it. But the flip side is, because it grows this root system, even if you fasted, it would stay alive because it's getting the glucose out of your blood. So those are the two sides to the story. But people, the worst scenario that I see with patients are the people who don't follow the diet, and they get into this revolving door of feeding the Candida, taking the program, having die-off, then feeding the Candida, making it grow back, taking the program, having die-off, feeding the Candida, making it grow back, taking the products, having die-off, and it just becomes an endless spin.
So in our last conversation, a number like 120 days of real good consistency seems to be what's in my brain for what you said. Mm-hmm. Is that a good number? Is it plus or minus 30? What do you typically see in people that serious chronic Candida that have been on that roller coaster for so long?
Well, the elimination part will be, let's see, most people do 1 month on our phase 0, and then we combine phase 1 with phase 0, which is where we start rotating the systemic herbs. They're usually on that for 2 months, and then they go to phase 2, which is where we use the antifungals or fatty acid base to kill the Candida deep in their gut, and they're usually on that for 2 months. So we're looking at about 5 months of the intense killing to get it. And how we know, how we can document this is by the tests. Because when we test the person, whether it's with an organic acid test or we look at a GI map and look at the trends or whatever, we're actually documenting what's happening. So we can see that it takes a certain period of time, and it sometimes doesn't matter how bad it is. It has to matter more with the nature of Candida, how Candida grows in your intestines, the fact that biofilm will cover it up, the fact that it will hide with other pathogens, and sometimes those other pathogens actually aid and abet its life cycle. This is why you very typically find pathogens like Klebsiella and Citrobacter and other ones. The worst one is H. pylori. Some of the hardest cases I've ever had have been people who had H. pylori and Candida at the same time. And I was very interested about a year ago to see references now starting to come out, studies actually being done where they talk about H. pylori and Candida in combination and how those are very tough cases for some reason. They didn't really go into the details of why, but I noticed that those were some of the hardest cases to clear. Well,
we could probably try to think through that. They used to do triple antibiotic therapy, and maybe not really addressing the H. pylori and just giving that Candida mega opportunity to mutate. But, now the skeptical part of me is going to say, we now found that H. pylori is a routine colonizer of the GI tract. And we certainly know that we all have Candida, but mostly albicans, right? Not these horrible strains that you're talking about.
That's true.
And so, if we were to say, okay, someone comes to you, doc, my gut isn't right. I might have $1,000 total to spend to try to get better. Can you help me for $1,000? And what would that look like?
I would say no, I can't, because first, the testing alone in one of these cases, depending on the case, would eat up half that money.
Okay.
So if you have a person,
does the testing justify or quantify or really level out the therapeutics that'll kill it? Is that the reason for the testing?
Yeah.
And you couldn't get it with, like you were talking, your caprylic acid, your oregano oil, your reishi, your carnivore diet.
All of those are used, but they're used in a sequence. Like the first thing we do with a patient is we put them on our phase 0, which mechanically affects the Candida. We use diatomaceous earth, we use cellulase, we use different substances which are going to break the protein bonds that the Candida makes to stick itself to your gut lining, similar to what blastocystis does. So we do that first to try to get rid of the surface levels of these organisms, the surface layers. Then we go into killing it systemically. And then after a few months where the test shows we're finished with that, then we go into the caprylic acid, undecylenic acid, monolaurin, these fatty acids that can kill the Candida deep in the gut lining. Now, at that point, the person is now ready to accept probiotics, because prior to that, the probiotics will just bounce off. And that was another one of the major discoveries I made, is that probiotics didn't stick. And this was when I was with Marty Lee from Great Smokies doing all those stool tests on people. We had people with zero lactobacillus, zero bifida showing in their stool. We had them taking hundreds of dollars worth of probiotics, and the tests kept coming up with nothing. They wouldn't stick. So we said, well, why aren't these sticking? Well, there've got to be pathogens there that are repelling them. And of course, the main pathogen was Candida. It was stopping the probiotics from sticking. Once we addressed the Candida, then the probiotics would stick. And that was a very valuable lesson.
And let's use that word, stick. So they're binding to the gut wall. In the case of the Candida, it's actually sticking in a root system. And where you're blocked, you can't bind. It's very, very simple.
And if the person had leaky gut syndrome, that made it even more complicated, because probiotics really can't stick when you have leaky gut. And as a matter of fact, then they escape through the lining of your gut into your bloodstream, and your body attacks them allergically. So made it even more complicated.
Well, and we were talking about, what percentage of our population, let's just go percentage of population with chronic gut distress, which is more than half the population has chronic gut distress. Mm-hmm. What percentage of that half of the population with chronic gut distress would get better, in your guesstimate, just on this Candida protocol done right?
Oh, probably 90%. Generally, 90% of the people will get better. It's the 10% or at the most 20% that don't get better, and that's not a technical issue. It's more of their lifestyle.
They're just not willing to starve the Candida.
Or they can't. They have issues that just prevent them, like they travel a lot, and the traveling interrupts the treatment. They have food addictions, alcohol addictions, drug addictions, or they have tremendous stress. Because I've done a very in-depth study of the people who couldn't get well, and it was more to satisfy my own curiosity. And I found that we looked at it and we said it was probably around 20% of the people, and within that 20%, we had there were all types of reasons, like who was in the mafia, who had the IRS after them, who was having to go to jail because of something, who had a girlfriend who was a drug dealer, who couldn't follow the diet because they were sugar addicted, who was diabetic. Like some of the people couldn't get better because they physically were too immune suppressed. They may have had end-stage cancer, AIDS, something like this. But then there were other people who had food addictions or chemical addictions, or they had so much stress that their cortisol was just so high that the cortisol was raising their glucose to the point where and suppressing their immune response to the point where they couldn't get better. But a person under normal conditions can get better from this if they have a reasonable amount of compliance. But the people who can't get better have, let's say, life interfering with their compliance.
I think that's a really good lesson right there, isn't it? I mean, the best program available isn't going to work if you've got some unrelenting stress that beats you down and keeps you from, being able to breathe freely, at least regularly on a consistent basis.
We all talked about stress, like even lay people over the years. People have observed that stress makes you sick. Stress gets you sick. You've heard this for years.
Sure.
Well, we now know, you and I now know the exact mechanism of why that is. It's mostly to do with cortisol. When you have a lot of stress, you have a hormonal stress response, which is your cortisol elevates. And we all know what high cortisol can do. So the mystery is removed.
Yeah, it's about death by 1,000 cuts, right? And one of those cuts is that suppression of the immune system in a way that what takes off? Yeast, parasite, virus, cancer. Those are the first ones to start going crazy. So yeah, it's not like one day you woke up with cancer. It's like you've been stressed out of your mind for a long, long time. And believe it or not, Michael, guess when I found my first rock solid, indisputable, where the medical literature said, yes, now we can definitively say stress is a rock solid cause of cancer. You know when I first found it?
No.
Publication date 2022.
Wow.
Even though we were lecturing about it in the 80s and 90s, right?
Yeah,
so
absolutely.
Pretty crazy that it takes that long to find it. So, all right, you seem to have really got good mastery on this. So what's next? Is there going to be a simple home test unit? Is there going to be easier kits? Are we ever going to get to do it yourself? What are we getting towards?
We actually have a urine test that we use with our patients, which is a home test.
Is that the Indican?
It's a combination of Indican. There's a special reagent that we have that makes Candida associated antibodies, like immune complex antibodies, solidify in the urine. They're basically albumin-based antibodies. And they'll solidify in the urine, so you'll get to see how much of this protein your body actually has that's fighting the Candida. And we have our patients do it. We used to do this in my office, but we accidentally found out that it worked better on a urine sample that was passed under an hour. So that didn't work for most people.
Right.
So we turned it into a home kit. And so the three primary things.
Measuring is volatile and disappears within an hour, so you got to get fresh.
Yeah, you need fresh.
Does it have to be after an hour? Urine?
Yeah.
First morning urine? Okay.
Yeah. So we have three principal tests in this kit. We have the Indican test. We have the special reagent I was talking about. And then we also use the oxidative test, which a lot of people know that. Yep. If you look the specs on the oxidative test, you'll see one of the things that it says that will elevate the test is yeast. And that's because yeast and bacteria produce alcohols. And some of the free radicals they're measuring that in that test are alcohol driven. So in your body, how does your body make alcohol? Well, yeast. Your intestinal tract ferments sugar or carbs into alcohol, and then that generates those free radicals. So we have those three tests that are in there, and it gives us a very good idea of what's happening. The other thing that's very interesting about the special reagent test is that it gets worse when you're having die-off. And the reason why that happens is because when you have die-off, you're releasing more of these antibody-antigen complexes, so it just goes higher in the test. So you know that if the person is having symptoms of die-off and they're doing everything they should, and the test is worse, then that actually documents and qualifies they are having die-off.
Yep.
As opposed to guessing.
I used to present a case way back when about Candida, and a gentleman was pulled over and he flunked a drunk driving test on the breathalyzer. And then when they went and drew the blood, they realized he didn't drink any alcohol at all. It was Candida fermenting the sugar in his gut, right? So yes, people could get drunk. I was telling people the story the other day. I used to also use a slide where it said doctors are shocked by green blood. Mm-hmm. They actually opened up a patient, and some of the meds they were taking turned the blood green. Mm-hmm. So here's the deal. If your breath smells like alcohol, you're either diabetic, loaded with Candida, or all the above. If your blood is anything red, less than a beautiful red, you need to visit someone like Michael or myself. Michael, this is epic. So as we wind down, where can people find you and what's your ultimate message to everybody?
Well, before we go into that, I'd like to go through some of the key things that we found about a Candida treatment. A Candida treatment has to include a parasite cleanse because parasites and Candida and harmful bacteria harbor together. You do not take probiotics at the beginning of a Candida program because they won't stick, as we said before. You have to take them after you have the Candida under control. You have to rotate your antifungals, otherwise the Candida will become drug resistant against them. You have to avoid supplements when you're on a Candida program because we have two lists of supplements. One list is actually going to make the Candida worse and feed it, and the other list are going to block the effect of your antifungals. So virtually any antioxidant that somebody takes can neutralize the effect of an antifungal. And we have a list of vitamins which actually, when you take them, will feed the Candida and make it worse. So that's something people need to watch out for too. Those are some of the most common mistakes that are violated.
Well, that's why I'm saying if you got serious gut issues, reach out to Michael, because I have talked to very few people that have your passion for this niche. And I always say, hey, life's too short to deal with second best. So if you're struggling with that, Michael will clean that up. Listen, I'm pretty good at a lot of things, functional medicine. And I certainly love learning from people like Michael. You can reach out to me for a few other things. So those are the key points. Parasite cleanse, no probiotics at the beginning. Rotate the antifungals, 21-day max. You got to understand what supplements do or don't do with Candida or therapies. And it makes sense just to follow your guidelines completely, which is a beautiful summary of it all.
And the person could also get my book on Amazon, The Candida Chronicles, which goes into great detail, more than we can do here. And if they need to get a hold of me, they can do an internet search. They can look for health-truth.com, which is my main website. Or they can look at my two other websites, which are the New York City Candida Doctor and the New York City Thyroid Doctor. Now, why thyroid? There's a tremendous connection between Candida and thyroid. And in my thyroid work, I take into account a lot of the data by Dr. Weston Childs and also Eric Rind, who's the master at using your body temperature to determine how your thyroid is functioning. And we also use a lot of the data from Dr. Watts from Trace Elements Inc. Because Dr. Watts was the first one to really come up and clarify the mineral ratios in your hair that directly affected your thyroid gland.
There's so much wisdom out there. And you know what? Here's what I'll tell you. There really is nothing new under the sun. The wisdom is here. We just got to connect with the people that have it. I have a friend who's a sage of wisdom like you, Michael. He says there's artificial intelligence, but it doesn't even come close to sage, human, hard-earned, loving intelligence. And you've got it. You've got the passion. You've got the commitment. I'm honored to be your friend and colleague. And as always, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.